News on 6 brought to you by Jim Norton's T-Town Chevrolet.
After a break in the weather, Stephen says the heat will be cranking up again this week, and August is just beginning.
And that's when we usually see some of those really serious temperatures. So what does that mean? How do you prevent heat illness if you're going to be outdoors? We've checked in with Hillcrest Emergency Room physician, Dr. Jeff Johnson. He joins us this morning to talk a little bit about ways to keep us safe. Dr. Johnson, I know they're in the ER the last few weeks. What's it been like, especially when it comes to the heat issues?
Yeah, last week and the last couple of weeks when it's been really hot, we've been seeing people coming in for all kinds of kind of heat-related illnesses, dehydration, heat exhaustion, heat stroke. So, definitely we've seen that over the last few weeks.
Dr. Johnson, how serious is it when someone shows up to the ER with a heat illness? I mean, what kind of things do you see? I mean, close to losing their lives?
Sometimes, heat stroke is very, very serious. Those people can be very serious and can die. But it's certainly a range just from some kind of being overheated, some cramps, some heat exhaustion, all the way to heat stroke, which is the most serious disease that you can get from being out in the heat.
You mentioned some of those symptoms, and they really do. They can sneak up on you. I can attest to this. The joke was I went to a baseball game, didn't realize how hot it was, and within a very short amount of time between, you don't sweat. There's certain things you start to be like, now this is not right. I started to get kind of dizzy, nauseous. What are some of those symptoms, and what should you do when you're starting to experience that?
Yeah, symptoms can range just from some cramps, muscle cramps, up to, lightheadedness, dizziness. And then, as they progress to more serious heat stroke symptoms can be confusion, passing out, dizziness, seizure, coma. So they kind of range from just kind of mild, a little dizziness, a little cramp, all the way up to more serious heat stroke symptoms. Once
you've had some of those heat issues, is it possible to be more susceptible moving forward?
Yeah, a lot of people find that if they've had some heat-related illness that they're more sensitive to heat in the future. So if you've ever had that, then, definitely be more cautious, avoid the hot times of the day, stay hydrated, stay inside as much as you can.
Let's run through some ways that we can prevent heat illness and heat exhaustion and heat stroke. What are some of the ways that we can prevent it? Because I know to some people, they may think, oh, well, this seems obvious, but people get sick all the time.
Yeah, I think older people with chronic medical conditions are going to be the most susceptible to serious illness related to heat. So they need to be the most cautious. And if there are loved ones, we need to check on them more frequently, especially. And then for everyone else, just if you're going to work outside or exercise, do it in the cooler part of the day in the morning. Drink plenty of water. Get shade if you can, and then, get back into the cool if you can. If you start feeling poorly, cramps, dizziness, nausea, make sure you get inside, get some air conditioning, get some water, and cool off.
While we have you on this morning, I do want to ask you about COVID, because for a period of time there, we were visiting with you on, every few weeks to get updates. Talk to us a little bit about what you've seen over the last few months.
Yeah, we've definitely seen an uptick in COVID visits in the emergency room over the last, few weeks to few months. Overall, the new kind of variant that we seem to be seeing is a little less severe, which is good. That may be related to the virus itself or increased vaccination, the fact that, many people have had COVID, if that's implying some immunity. But, we've been seeing people get it. We've been seeing people come to the emergency room. Luckily, overall, the numbers of patients requiring hospitalization and intensive care unit is way down. So that's really is a positive. But yeah, we are definitely seeing uptick in diagnoses and seeing people with symptoms in the emergency room.
In terms of back to school, Dr. Johnson, of course, TPS goes back August 18th. Many other districts very soon. What kind of vaccines do we need to think about getting for our kids? Do COVID vaccines, do those need to start becoming a standard part of the back to school vaccines for our kids?
Certainly we have vaccine schedules for children that, the schools are going to be requiring. I think at this time they're not requiring COVID vaccines, but they are available to parents and children, all the way down to school age and even younger. So certainly as a proponent of the vaccine, I would say, vaccinate your children. They've been proven to be safe. So, you know, they're not required, but certainly they would be recommended.
Well, Dr. Johnson, as always, we appreciate your insight and your help as we navigate, certainly heading into the month of August. We anticipate it's going to be a very busy month, and I hope for your sake it's not super busy there at the ER.
Thank you.